Hi YouTube fam, I am Angeline, the nursing assistant. Welcome to Informative Friday. On this Informative Friday, I will be discussing what to do if you're in a position where a patient is having a seizure. As a nursing assistant, we come across all different types of situation. And when we walk into a situation, we have to know what we need to do. A lot of times, we don't have a lot of time to react. So we need to know what to do at what situation. So on this Informative Friday, we are going to discuss what needs to be done if you walk in on a patient that's having a seizure. The first thing we need to do is immediately call for help. Hit the call light or hit the emergency light, whatever your facility have in place for emergency. So the first thing we need to do if we walk in on a patient that's actively having a seizure, hit the call light, emergency light, whatever your particular facility have in place for an emergency. After calling the emergency light for help, the next step you would do, if the patient is lying in the bed, you will pull up the bed rail, pad the bed rail with pillows, blankets, whatever you see that will help prevent the patient from hurting him or herself. If the patient is sitting in a chair or a wheelchair, you will lower the patient down to the floor and move all furnitures, tables, or anything around that patient to prevent that patient from hurting him or herself. After you have made the patient safe as possible, you will then turn the patient head to the side to prevent aspiration. After you have turned the patient to the side, you will try to loosen up the patient clothes, especially around the neck area. Do not put anything in the patient's mouth. I know years ago, they always said, put your hand in the patient's mouth to bring the tongue back. If the tongue kind of roll back in the patient's throat, now that's no longer what you would do. Do not put anything in the patient's mouth. As the patient is going through the seizure, do not try to restrain the patient. Let the patient move freely. And also, if you can remember, try to note the time that the seizure started. Or you can note the time that you actually walked in the room if the seizure have already started. And also kind of note or pay attention to the time that the seizure ends. If the patient is having a seizure in a public place, try to get the visitors to move back. Try to give the patient some kind of privacy as he's going through his process. If I didn't mention it, you will also, the patient that you have lowered to the floor, if that's the situation, you will also cover that patient with a blanket for privacy and his dignity, especially if he's in an area, a common area where other people is around, because you want to give him privacy and make sure the visitors or anybody in that area kind of get out of the area so the patient can have his privacy. Also, you would stay with that patient, by that patient's side, to the end of the seizure. Usually when the seizure is over, the patient is kind of exhausted from what the seizure has caused. So a lot of times you just have to sit there and let the patient rest and get her or his composure back before he's able to get up or before you're able to move him. Once the patient is out of his seizure and ready to get up, you help him get up, put him in a wheelchair. If they're on the floor, you put them in the wheelchair and take them back to their room, get them comfortable, and you would take their vital signs. And if the patient was already in the bed, you would give them time enough to get their composure back, get their strength back, because most of the time when you're having a seizure, when you come out of it, you're weak. So you want to give them a little time to get everything balanced and take their blood pressure, take their vital signs to make sure that they're okay. 9 times out of 10, people that have seizure usually come out of it and they're back to their basic, condition. So you guys, that's it for this Informative Friday. I hope you guys got some out of it. If you would, subscribe, like, and hit that notification bell, because you don't want to miss not one of my videos. Not one. Come on. Come on. Come on. Let's get it started.